Health authorities over in Israel are looking into the possibility of offering a fourth dose of the COVID-19 vaccine to those who are immunocompromised as the country seeks to boost its defense against the pandemic amid concerns over Omicron. For more, I have Professor Cyril Cohen at the Bar-Ilan University live on the line. Professor Cohen, it's been a while. Welcome back.
Thank you very much. Hello, Sunny. Always a pleasure.
Right, thank you. Professor, let's begin with reports of Omicron over in Israel. I hear there have been 21 cases as of Monday, and some of them include people who had received booster shots. Please tell us more.
Yes, that's exact. We know that a few people have been infected with the Omicron variant, including people that were vaccinated. Basically, we had the cases of two doctors that were abroad. Those two doctors actually are doing fine. They are vaccinated again with 3 doses. And the very interesting thing is that based on what we know, they haven't contaminated other people, though they were in close proximity with those people. So far, all the cases we have with the Omicron are just mild cases in Israel.
Right, that is good to know then. Professor Cohen, data on Omicron is evolving as we speak. But based on the information available thus far, what are your thoughts on the risks it poses?
It's very problematic now to say, what the risks are. But I will say it like that. There are 3 things that we are looking at. First, is it spreading faster? And the answer is yes. We believe it is spreading faster than other variants. Second thing, will it cause a more, I would say, severe condition, disease? We do not believe so based on the limited data we have. And third, are the vaccines effective? That we don't know yet. We are kind of extremely concerned by some reports that we hear from South Africa that people that that got the disease were reinfected. And of course, you mentioned the fact that people that were vaccinated with a booster shot can be infected. So these are the 2 elements we have right now, but we don't know to what extent the vaccine is protective against the Omicron.
Right. Professor Cohen, some observers say the emergence of Omicron looks to perhaps usher in an end to the pandemic first. Do explain this view for us, and then do tell us whether or not you share this outlook.
Yeah, so some people have been saying that it might cause a milder disease and it is spreading fast, therefore it might help immunize the population. I personally do not share this assessment because we don't know yet about the severity of the disease. Most of the cases we have seen and also heard about were people that either are vaccinated or young people, students, for example, in South Africa, that usually do not develop severe disease. So I think that we need to be a little bit more patient in order to make this assessment. I think it's too early, and personally, I don't think it is the case.
Right. And having said that, Professor Cohen, how do you respond to concerns over the efficacy of our current vaccines against Omicron?
Yeah, so I think that if there is, if we observe a kind of reduced effectiveness of this, I would say, of the vaccines against the Omicron, there are a few things that we need to do. First, we have to work on an updated version of the vaccine, and I know that companies have been saying that they might be doing that, and it will take them 3 to 4 months. So again, that's not the best, but again, to wait, I'm saying, but it is necessary to wait. Second thing is that we might have to revert back to some measures, like for example, limitation of gatherings. I hope not lockdowns, but things like that, and enforce that.
Right. As I mentioned earlier, Professor, authorities in Israel are now considering a 4th dose of the COVID-19 vaccine for those with underlying health conditions. What are your thoughts on this initiative?
No, I think it is a good idea to have people that are immunocompromised. I'm talking only about immunocompromised. Today, we're going to have actually a meeting about that to decide about the policy. But it is a good thing because what we have seen is, for example, after 2 doses, the level of protection for certain people that are immunocompromised was around 25%. With a booster shot, it went up to 60% compared to normal people or healthy people, I would say. So therefore, I think it is a good idea to try and do that. I don't foresee any particular side effects because at the end of the day, those people have a diminished immune system, and most of the side effects that we have seen are due to, inflammation or autoimmune side effects due to the immune system. So I think that this is a good thing to do. We're going to try that. We're going to see what will happen with that, and hopefully they will be better protected.
And what, Professor, has been the public response to government plans, that is, for a second booster shot?
We haven't, really looked into that. You're talking about a fourth dose. I would say that people are usually receptive in Israel when there is a need, and when we explain that, what the basis for that need, people usually respond well. You can see that, for example, people around the age of 50, 60, up to 90, and so are 80% to 90% vaccinated with a booster shot because they understood that after 6 months, 2 shots were not enough. For the younger people, I would say they are, more reluctant to get that third dose. So I think it will be the same for a fourth dose. I think it's on the basis of the need, and people that are really concerned will take that shot.
Right. Professor Cohen, one quick question before we let you go. Aside from border controls now, what other measures do you suppose could serve to perhaps stem the spread of Omicron?
Yeah, so again, border control is essential, but also testing, especially people that are coming back from abroad, because we know that you cannot have, some people are traveling. So I think that this is important to test them 3-4 days after they come back to their country. I think that we need to enforce the regulations we have in general, meaning like social distancing, hygiene, masks. There's nothing new here. Let's hope that the Omicron variant is not as terrible as we thought, and the vaccines are working. That's what I can hope.
Right, let's keep our fingers crossed. All right, Professor Cohen, as always, thank you very much for making the time to join us live at this hour with your thoughts.
Thank you.